Welcome to NCPDP Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
All right, so we are at our work group meetings in Denver and thrilled to have our partners from CMS here with us. So I'm going to have you ladies introduce yourselves and we're going to dive into some questions. So Kelly, you want to go first?
Thanks, Pooja.
Yeah.
I am Kelly Strachan. I work at CMS and I help lead our GLP-1 access work.
Fantastic.
Hi, I'm Aurelia Chaudhury. I also work at CMS and I support the Bridge Demonstration.
Fantastic. Well, thank you so much for joining us today. So obviously GLP-1 therapies has been, quickly becoming one of the most talked about topics in healthcare. So let's just start there. CMS started this GLP-1 bridge and curious to find out why you guys decided to do that. What was the impetus for CMS to take this on?
Yeah, so the GLP-1 landscape has undergone a lot of changes in the last several years, and I think one of the key changes has been the growing evidence base around the kind of medical impact that these GLP-1s can have independent of weight loss. So, for example, we see in patients taking GLP-1s cardiovascular benefits, metabolic health benefits, improvements in quality of life, again, all, besides the underlying weight loss. Of course, as you know, Medicare has a prohibition against Part D coverage of drugs that are prescribed solely for weight loss. And so we found ourselves in a situation where you've got beneficiaries who might potentially really benefit from these treatments, but who don't currently have access through the Part D program. And so I think that's what created a right moment for CMS to think about using its demonstration authority to test whether expanded access to GLP-1s could be beneficial to our population.
That's great. And the program has been live for about a month now, correct? Yeah, okay. And so what kind of surprised you so far? And curious if you guys have any numbers or stats to share.
Yeah, of course. So we're very excited to say that the first few weeks of the program have been very successful and the rollout has been smooth. Happy to share that over thousands of pharmacies across the nation, as well as over 250K beneficiaries have now access to GLP-1 under the Bridge program. So feeling good about the demonstration so far. I would say what we want to highlight is the importance of just working with industry. We found that during this rapid rollout and ramping up this program together, working with thought partners like NCPDP has been so crucial in getting that industry input.
Yeah, that's great. And I know in preparation for the program, you guys did work very closely with our members. So I would love for you guys to just share kind of your learnings out of that. And then also, what are you hearing from industry, from pharmacies and from providers or even the beneficiaries? Kind of what's the feedback been so far?
Yeah, so I think the highlight of my day so far has been that we've been talking to a lot of the NCPDP members who are here about how their experience with Bridge has been going. And I think we've been really gratified to hear that it has been going reasonably smoothly, right? Of course, not perfectly. There are hiccups at any rollout. But for the most part, as Kelly said, people are able to find their way through it. We're able to work through challenges, and pharmacies are able to submit claims. Beneficiaries are able to pick up their medication and start benefiting from the expanded access to GLP-1s. I think we've received so much helpful feedback from the pharmacies throughout the process. I'll just offer one example. So as we were, designing how the operational workflow in Bridge would proceed, we initially imagined that prescribers might need to communicate to a pharmacy, this is a prescription for weight loss and it should really be sent to Bridge and not the Part D plan. And at first we imagined that communication could be done via an annotation, either a notation on an electronic prescription or just a note on a paper script. And as we engaged with the industry, we realized some of them were telling us, actually, it's really helpful for us to have this as a structured data field so that we can analyze these in batch and figure out this is the set of prescriptions that need to go to Bridge as opposed to sort of a free text annotation. And so we updated the way that we were instructing providers on how they wanted to communicate with pharmacies about prescriptions that should go to Bridge via the Part D plan, and suggested that they use both the annotation and the diagnosis code to accommodate the different kinds of operating systems that pharmacies have. And we've gotten positive feedback about how that's worked in the rollout. And so it's just sort of a small example, but I think a good one to show just how valuable it is for us to get that sort of rapid feedback from industry about what works well with the existing systems that they have.
Yeah, that's great. And I know you guys had come to our annual conference as well and kind of had an open listening session, because I think that is so important, right? And I think it shows the true partnership between, CMS, HHS, and us as a standards development organization. And so, happy that our members were able to provide some of that feedback and give you guys that information. So how would you guys measure success of the program? Are there specific outcomes or metrics that you guys are currently looking for in this kind of, in the program that's going on right now?
Yeah, great question. So per our 402 demonstration authority, we are required to conduct pretty rigorous evaluation of the program itself.
Okay.
And we're equally as eager as folks out there to learn more about what we're seeing within the program. And so outcomes we're curious about include adherence and utilization of GLP-1s, which are fairly new in this population for weight loss, as well as learning more about the provider, the beneficiary, the plan, the pharmacy experience as well. And then, of course, unintended consequences. And so we're hoping to have more tangible results and learnings in about 12 months' time about what we're seeing with expanded access, and hopefully inform a longer-term solution, too.
Yeah, that's great. I think that's one thing I've been hearing a lot about, and kind of switching to that, right? I think, obviously we're grateful that some of our standards are being used for some of this, right? With the telecom standard, being able to get that rejection, right? And then saying, okay, this needs to go through. Just curious, as you guys are thinking about this, are there other standards, I'm thinking prior auth, other things that you guys may be looking at in terms of standards to be able to make it a little more automated? Any kind of thoughts about that?
Yeah, so I think, the important thing for us going forward is identifying what are the friction points that are happening right now in the process, and how can we continue to resolve those friction points. And again, walking around today, talking to people, hearing the feedback, I think we are identifying some bumps in the road, and I think the standardization process that NCPDP has set up offers a really valuable toolkit in terms of finding ways to address some of those points of friction, whether it's getting consistency around use of the beneficiary's appropriate MBI instead of their Part D plan identifier, or other different hiccups that might come in.
Yeah, makes sense. So looking beyond the program, kind of what else are you guys looking at in terms of reducing administrative burden? Mm-hmm. Anything else you guys are working on currently that you want to share with our listeners?
Yeah, I mean, for the most part, we're excited about the uptake and improvement of EPA. And so, as you may know, under Bridge, we accept prior authorizations in two ways, EPA or by fax. Overwhelmingly, folks are using the EPA process, but fantastic. I know, great news. We do want to help identify any patterns or help with any support for the minority prescribers who are still using fax, and try to encourage them to adopt EPA in the best way possible, such that we can have real-time decisions being made and improve the beneficiary experience too.
Yeah, that's great. And I know that is something that we've been working on with you all as well, is how do we get more of that prospective prior authorization, which means that, the doctor can do it electronically. So that's great too. I didn't realize that's a majority of the prior auths are going that way. So that's fantastic. So if we were going to connect in 6 to 12 months from now, what would you hope that the industry is saying about the GLP-1 bridge?
Well, I think there's three things I'd hope to hear. One is, I think we'd hope to hear a real excitement that CMS can pull off something big and ambitious and fast. I think when we first announced the GLP-1 Bridge Demonstration, people were a little hesitant about us rolling out on July 1st. It's a big program. It's a lot of changes to the existing workflow, and it was a short time frame for us to pull it off. But we really have, I think, achieved a lot of success and a lot more in a short period of time than any of us thought possible. And so I hope people are able to take away from that experience just what CMS in partnership with a broad stakeholder community is capable of achieving. The second thing I'd hope people take away is that we really did learn and listen and talk and communicate throughout this process with, again, the broad set of people who had to work together to make this come to life, including the pharmacy community, including the prescriber community, including the beneficiary groups, including the manufacturers, that we were a good, supportive partner, that we really heard people, we made changes where we could, and we committed to being in the room when we had to be. And then the third thing I hope we hear is that this program has really improved the lives of our beneficiaries. I think pharmacists arguably have the most frequent contact with our beneficiaries of any provider type, right? They see our beneficiaries come in, every week, and I hope that they're able to see that our beneficiaries are benefiting from access, that it is achieving the improvements in cardiovascular health and metabolic health and quality of life that we are hoping to achieve through the demonstration, and able to show that when CMS uses its demonstration authority, it can really redound to the benefit of our Medicare beneficiaries.
Yeah, that's fantastic. And it was. I mean, we obviously heard as well, like members, when it was first announced, it's like, how are we going to do this? So, we kind of have that same thing. But you get everyone in a room talking, and and obviously in partnership with you all, for you guys to pull this off, it was wonderful. So, well, so grateful for you guys' partnership, CMS's partnership, and thank you for taking the time today. I would love to kind of reconnect maybe in 6 to 12 months after it's done and learn more. But for our listeners, if you guys are interested, I know CMS, you guys attend all of our work group meetings, and it's a great place to connect and be able to share information. So thank you both for joining me today, and truly appreciate your insights into the GLP-1 demonstration.
Thank you so much for having us.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.